Hey everyone, my name is Sienna Boyd. I'm the community rep at Rancho Family Medical Group. And today we are with Dr. Matt Combs, who is our hospitalist, one of our hospitalists at Rancho Family. And we just wanted to chat with you about what a hospitalist even is. I hear that's a more new term in the medical field. So can you explain what you do for us?
Yeah, so I would say probably 10 years ago, or maybe a little bit more than that, hospitalist wasn't even really in existence.
Okay.
When you had a family doctor and you had to go into the hospital, that doctor would come in before clinic and see you, or see you after clinic, and it was really nice because you were taken care of by your doctor, whether you're in the hospital or in clinic.
Right.
As healthcare changed, some for the good, some for the worse, that started to go by the wayside a bit.
Okay.
And it ended up being physicians that were hired essentially by the hospital just to take care of patients that came into the hospital.
Okay.
And so they would have never met you before, wouldn't know anything about you, may not even know who your doctor is in clinic.
Okay.
And would be taking care of you. They would take care of you while you're in the hospital.
So if I got admitted into the hospital, a hospitalist hired by, say, Temecula Valley Hospital would be in charge of my care, but I traditionally would never have met them, right? Is that what you're saying?
Essentially, yes.
Okay.
And they would, in general, have no connection whatsoever with your primary care doctor, with your family care doctor.
Oh, that's a bummer. Okay.
Yeah, so you can just imagine how that would create areas for miscommunication, for disconnect, for medication errors, just lack of continuity. And in medicine, we use the term continuity a lot to describe a fluid continuation of care between specialists, between hospital, between clinic.
So important.
And with that system, it can work, but there's a lot of rooms for errors.
Sure.
And also, it just takes away a little bit of that personal touch and that relationship touch.
Okay.
And so one of the nice things that Rancho does is they hire people like me essentially to have a bit of a hybrid hospitalist program, I guess you can call it.
Oh, okay.
Where if you are a Rancho Family patient, you will be taken care of by Rancho Family providers.
Okay.
And it may not be your exact doctor you saw in clinic. So if I'm your doctor in clinic, I may not be the one seeing you in the hospital.
Okay.
But they're actually providers that work for Rancho Family.
Okay.
That have access to your records in clinic.
That's awesome.
That know your medications you're on, that have the phone numbers for all the providers that are at Rancho Family. And it just allows for way more communication, facilitation of care.
That's awesome.
And so it's not quite like the olden days where it was your actual doctor that's seeing you, but really in my mind it's the best compromise where you're being taken care of by someone that's part of that same group, that knows you at least through the electronic record system and can communicate with your doctor a lot easily if need be.
So what you're saying is, say if Dr. Madrid was my primary care physician and I got admitted into the hospital, you would come and see me and you could talk to Dr. Madrid about what prescriptions I was on and what we were doing for my care. So you have that direct line with him.
Exactly. And so if there's a question about, hey, why are you taking this medication? And I'm not really so sure we need this anymore. I could run it by your primary doctor, Dr. Madrid, or someone else. Or if I'm discharging you from the hospital and there's something that's not quite totally finished up or something that needs to be followed up on, I could shoot him a call or send him an email and say, hey, we need to follow up on this, or can you get this person in soon so that we can make sure that everything is wrapped up nicely. And it's worked out really, really well. It's been a really good system.
That's awesome. So it really does keep patients that are part of the Rancho Family within the Rancho Family, even if they're admitted into a hospital. So
and again, that term continuity that we use it's our way of trying to facilitate the smoothest transitions between the hospital and clinic. And the hospital is really where people are the sickest. And so that's really where you want that transition to go smoothly.
Yeah.
And if it's done wrong, it could be potentially dangerous for the patient. And so I think this is really been a good system in place that we've gotten going.
Awesome. Well, thank you, Dr. Matt Combs. I so appreciate you joining us and just explaining what a hospitalist is. That's super informative.
Not a problem. My pleasure.